Hey, everybody, welcome to the Better Wounds podcast. We're diving into some of the complicated healing processes after cosmetic surgery. I'm Heather Flexer. I'm a physical therapist and a certified wound specialist, and I help folks after their cosmetic procedures if they're having wound complications all over the place. And this little series that we're doing right now is really because I'm preparing for my own cosmetic procedure. And I feel super fortunate to have helped so many people and have so many resources. And one of them is ANF Therapy. And Dr. Mikel Hoff is the founder and the creator of Amino Neuro Frequency ANF Therapy, and he's joining us all the way from Spain. So I'm really excited. Thank you for taking time and joining me today.
Always is very nice to be here and to answer your questions and maybe also enlighten you a little bit of a deeper understanding and deeper knowledge for sure.
Absolutely. Always learning, always a pleasure. You're always
Mhm.
putting out more information, and every time it's like just, I didn't know. I gotta do, I gotta do more work.
Yeah,
Um, yeah. So tell everybody what ANF therapy is.
yeah. First of all, my name is Dr. Michael. Over 30 years experience inside of medicine and neurological biochemical function of the human body. And ANF is the solution of non-symptom treatment is treating the source of the problem or normalizing the neurological and biochemical action that create our immune system, our optimization of the average health by enhancing the neural oscillation of the nerve pathways. Because we need to understand the basics here is that we can today more or less change everything in the body. We can do nice breast lifts or fix our face. We can get a new liver. We can get a new heart. But if the nerve system go down, it's nothing that could be done until ANF. And when we talk about these procedures that you're going to do and many other women is doing, we need to understand the system that control the healing and preventing of any kind of infection or complications post-surgery, by also understanding how my body is pre-surgery. And for ANF, is this amazing? This is a medical device that is approved and also what's called registered in Ministry of Health and FDA around the world as a professional device for professional use. The only alternative that have this high classification is so many different continents, which we are very, very proud of because of all the clinical evidence that we have. We work with several universities, we work with hospitals, constantly doing studies. And during now, since I invented this over a decade ago, we have used this on everything. And especially also when we come to what you talk about wound healing, the fear for infections or complication, because the surgery procedure itself is quite simple. No matter what we do, it's the process afterwards that is actually extremely important.
I think a lot of like the people that I talk to and everything, they're used to like the lymphatic system, that there's healing there. They've got to wear their compression. They're like really aware of all of that, get their massages, get their compression done. But this would be completely different for them.
Absolutely. I mean, first of all, we need to understand the nerve system and lymphatic system is our immune system. Everything that is done to the lymphatic system or attacked to the lymphatic system will prevent your immune response and your immune system. When we talk about lymph massage, it actually not stimulating anything more than the tissue and continued contractions. We need to understand that the lymphatic system is 15 liters of lymph liquid that have 600 to 800 different lymphatic knots that have each knot have 5 different immune responses. Every night, the lymphatic system need to remove 3 liters of lymph. Means a good advice for all of you that are going to do this kind of surgery is to make sure every time you go to bed, the last urination, your urine need to be clear. That means your body is hydrated. It can change out the old lymph to new lymph, means your healing process is going much, much faster. What we're doing with ANF therapy with the lymphatic system, we have specialized protocols to, as a woman, you should actually do your lymphatic protocol 1 week per month. Because when we talk about the female body contra male body, thank God I'm a man, our body is extremely simple. I mean, the female body have more than 500 different chemical cells and hormones that actually the main cause for them hormones is to create collaboration and stabilizing of resources. So when you female talk about estrogen and progesterone, blah, 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 all of these hormones have many, many more important tasks for all the vital organs in the female body than actually people know about. And one of them here is the key is the lymphatic system. So this is a highly recommend. You're lucky guys to have Heather there that can help you to do these protocols, but always keep your lymph system clear from any kind of inflammation, because that is the active immune response for infections, inflammations, bad organ weakness, and many, many other health issues that people have. In normal medicine, when we go to medical school, we learn we have a lymphatic system, but nothing what it does.
It's there, don't touch it.
Yeah, exactly,
Yeah.
because they cannot do anything anyway.
Yeah.
And, and you know, as well as a physiotherapist, that the knowledge there is very limited. But if we understand that better, before I do my surgery, before I'm going to do anything surgical or anything to my body, I need to make sure my immune system is strong and healthy.
Yeah.
People today, we try to think that we can buy health. I just buy 15 different supplements and 15 different vitamins. But a good news for you all, I hope I can say this, is if all these supplements of ours would work, we wouldn't have diseases if they do what they said on the thing. So I think that the Heather's knowledge, what we teach her from here, is more important to you guys than anything else for sure. And the good thing with ANF therapy is, as I said, no chemical, but the effect is more or less instantly, and it's long-term effects, which is really, really important.
Yeah. I mean, I've used it for ANF since 2017 with my in-person clients, and it's pretty amazing stuff. I mean, those are folks that I'm working with like pain, and a lot of times we're working on stress too, just because when you're injured, you're freaking out. And like I'll be wearing these for the week prior to my surgery because I'll be freaking out because this isn't my normal mode of being. So I try to avoid procedures, but we're going in as healthy and as strong as possible. So I'll definitely be wearing my discs. But
Yeah.
this was previously only available through medical professionals, but recently you put out ANF Care, which is what kind of
Yeah.
pre-packaged systems for folks to get.
Yes, yes, yes. And the reason I was actually a long time resistant to do any kind of these products B2C, as you know, because I want people to go to get professional help, professional knowledge, uh, feel that this ANF practitioner, Heather, or anyone else I go to, they really care about me as a patient. I am in focus. And it's not like a speed treatment where you have one patient every 10 minutes. And then here you go to an ANF practitioner and it takes 10 minutes, but most likely 45 minutes, 1 hour, but we put you in focus.
Right.
But then I started to thinking that it's quite sad that people go to the pharmacy, buy all these pills. And we need to understand in a double blind test, you need 2 to 4% positive results for any pharmaceutical to be able to be sold and approved, which is very, very little. and we stuffed that into kids and stuff. So I said that no, my dream is really to make sure that private people can buy these for certain conditions without toxify anyone. So we did ANF Care, and it looks like this. It's can I show it to you?
Yeah.
So this is the we have for wound healing, post surgery, we have for flu, we have for cold, we have for sore throat, liver detox, and many different programs that you can find on anfcare.com or at Heather's place or order through Heather. And this is actually that you can have your own neurological frequencies pharmacy at home, and you will be so astounded how fast the effect is
Hmm.
for sore throat or after you go for your surgery now and do your thing and apply it immediately. It can be used on newborn babies to the really elderly grandma without any kind of complications. The only thing that is important is to actually be hydrated, stay away from sugar if you want to make it better. But I'm super proud over this program, and it's been out now for a while, and the feedback we get from patients and people all over the world, because now they can buy it through your link or anyone, and get it delivered directly home, with full instruction and everything. But still, if they have any questions, we are always available. And this program is for any kind of the normal day problems that, and you can go to, as I said, I'm sure you're going to tell them, anfcare.com, and there you can find different kind of, oh, I want for this, I want for this, I'm going to do after my aesthetic surgery or whatever it could be. And it's very good. And we
So,
will come. Now, I will give you some exclusive news.
oh,
Uh,
okay.
It will come a special program next year for aesthetics, ANF
Okay,
Aesthetics,
great.
that we tested now for a time.
Cool. Are we getting rid of our lines? Wrinkles?
Yeah,
Perfect.
exactly that. I
Yeah,
mean, all we tested now for eye wrinkles, for skin moisture, for cellulites, and you will be blown away how effective it is. And this
great.
is also special devices that is included there. It will
Yeah,
also be B2B.
yeah. And when you're talking about different devices, we're talking about like every different disc is a different device. Like they have different
Yeah,
names. So in the
yeah.
package, we've got different combinations meant for certain
Mm,
things. So instead of having to come here or come to me for something like a simple incision care, you've got
mhm.
it all kind of packaged together. Now, with the skin and the wound stuff, you had two packages. You have a wound and you have a scar.
Yeah,
So is I would assume the wound one is more of an open wound, something that maybe isn't healing well.
yeah.
Yeah,
Uh, the wound package is extremely important because that contains glutathione, carnosine, white blood cells, and all these important biochemical actions that is necessary to prevent for any kind of infection and really speed up the healing. I mean, the healing process is so fast considered to normal, and removing the infection. We tried it on hospitals and stuff like this, and they are so shocked about the results and how fast it actually, by stimulating the nerve system to heal it. This also means that your scar afterward will be minimized
absolutely.
because after surgery, if you do a breast implant or if you do whatever you do for surgery, as soon as you cut in the skin, you create an acute inflammation in the area. That means now the lymphocytes beckoning and everything create an immune response. And then after the surgery, we put it together again, nice as good as we can. But still, that active inflammation stays for weeks and for months, as long as it's sore and as long as it's healed properly. Then, for these kind of scars, even if a cesarean that is 10 years old that we try this on, the elasticity in the scar tissue more or less be removed because this scar tissue can grow by itself without any active inflammation because of negative skin cells and enzymes in the area. So it's two different. I would do it like this if now you're going to go on a surgery yourself. So as soon as I more or less come off the table, I would apply the wound protocol directly.
Okay.
And then together with pain and inflammation, or if you have pain, which you probably have, because I know if you're going to do breast, you're going to be very sore and you're going to tell your husband to stay out of the way.
I got it. Don't
Because,
bother. Yeah.
yeah, okay. Anyhow, and then after some couple of weeks, when the pain is less, I will start to apply the scar one.
Okay.
And then, as a physiotherapist, you can stretch it and massage it. And you will be very surprised how the scar line will be so thin and so small, you will probably never, most likely not even see it.
Perfect.
It's really, really good.
So even if they don't have the open wound, start with the wound package first and then move into the scar package.
Yeah, I would say like this, if you have an old scar that is healed, it's just a lot of scar tissue, I will
Yeah.
use the scar for sure.
Yeah.
If it's any kind of redness around the scar, irritation, and I will use the wound one.
Okay.
And you can also combine the two at the same time. It's just maybe if you have a small scar, a lot of devices on a small area. But
Right.
otherwise, you can combine the two as well. So it's no problem.
That's pretty cool that you're seeing results even because with like C-sections or tummy tucks type stuff, sometimes it's way after when people start complaining. Like I've had a section and have had pain forever with it. That you're seeing, results even on older. Yeah.
Yeah, because most patients I get with scars is typical C-sections. It can
Hmm.
also be from any kind of organ surgery or open heart surgery. And people don't realize I had the surgery, so how can I still have pain?
Hmm.
Because they don't realize that the scar tissue that is maybe growing very slowly, it also irritates everything around it. And that can give you a lot of pain. Uh, and they get super amazed how the scar is changing. I had a woman, she had like 3 or 4 kids. The oldest was like a teenager, but it was long time since delivery. And she had actually two last was C-section, whereas one was acute. And then the scar is not a nice line; it's like fast. It was really bad. And she had a lot of pain over uterus and all because of this, because it grew down. And we started to remove her active inflammation in the area and then use the scar protocols that you have available. And it took 2 or 3 weeks, and the difference was so significant. She was so surprised. And after that, she never had pain again. And all this bulking when she was bending over from the scar tissue or uterus pain, it was gone. So it's very nice. It's very effective, yes.
Perfect. And is there anything like anyone needs to be aware of, like side effects with medications or not to mix things together?
No, I mean, it's if you any medication that you're necessary to take, you can still take. You can, as a patient, get what's called detoxify. The body can never heal without removing toxins and bacteria. And that's through the lymphatic system that we talked about before. So that can give you a headache. You can get a little bit nauseous. Extreme cases, if you have big holistic protocols, but we're not talking about here, you can get even vomiting and a little bit shivering and freezing. But that normally pass very fast if you drink water. So it's not a long-term problem. The only thing is that if you use, I saw you show the energy devices, for example, is not to put energy on a pregnant woman, for example. So you start the delivery immediately. That's not a good
Let's
thing.
not do
Uh,
that. Yeah.
Otherwise, no, they can be used on any kind of person. It's just to know that you can get this detox, but through Ministry of Health and FDA, detox is not a side effect, even though if you can get this feeling, it's actually a way for your body to actually clear out everything that is prevent your body to heal optimistically.
Yeah, I think I've only had that kind of situation with one client, and they had multiple issues, and we kind of did a lot of hands-on body work, and then I put a lot of discs on her, and then she didn't feel great, but she felt fine when she, took some water and took a nap. So,
Yeah,
yeah,
yeah, yeah. I say it's very rare to get severe detox. But I, of course, during the years had some patients with that, but out of 10, it's one. And
yeah,
they, as you said, they're heavy medicated. The body is in general really bad condition, and we do big lymphatic protocols with cardiovascular stuff and maybe other manual work, and then of course you get a reaction.
yeah,
But
yeah.
which I say to the patient, it's good. That means your body reacts, uh, which is a positive thing.
Right. And most of the clients we're talking to in this situation, they came into the surgery relatively healthy, and we're just kind of dealing with this one issue, not someone that's been in long-standing chronic
Mm.
disarray for a while.
Exactly. So it's with this ANF Care program that is B2C, we also have ANF Care for you as a therapist. You can order the special device for you as a therapist in a special therapist pack, so you can pack them yourself. Uh, it's all of this is taken under consideration. This is for this treatment, is for this problem, for this and this,
Yeah.
and it's following clear instructions how to place it, where to place it. If they have any question, they can ask you or they can
Mm.
contact us or whatever. So we always there to help, even you. So it could not be an issue. But for all these women that you work with that ask you this question, how can I heal this better? I still have pain. This is the tool they've been waiting for sure.
Yeah. I'm excited to get it out there more and help more people. And I thank you so much for joining. And if anyone's looking, I know you said anfcare.com. I'll
Yeah,
post links below. I have like a special link for everything, but absolutely, if you're dealing with a wound issue, dealing with a scar issue, I do consultations. We can talk about like what you can do for it yourself. We can get you a package. We can kind of organize it all. But I usually talk to my folks in some way, whether it's through a message or
yeah.
however, a consult. So I'm always still here, like on a one-on-one basis, but this is great to have, another option where they can kind of DIY things because we know people like to do that as well. Yeah,
Yeah, but I think it's also good that it's people out there that like you that are focused on this area because it's a forgotten area more or less, and that is really really important. If you look at the long-term condition that can become a problem later, you need to take care of your wounds, you need to take care of your scars, and understand what's going on. So I suggest for you guys that see this, if you have any questions, just talk to Heather and if she cannot answer you guys, she can ask me and I will help her to answer you. So then you also get the right kind of treatment when it comes to this for sure.
absolutely. Thank you so much.
Oh, my pleasure. Anytime you want, I'm here.
Okay, great. I can't wait. We might have to do it again after. I'm like,
Yeah,
what did
yeah,
I do?
yeah. That, that would be cool.
Yeah.
Yes, of course. Okay.
Okay. Thank you. I'm gonna